Lub dub, lub dub, lub dum, lub dum, lub dum, lub dum, lub dum. Wonder what that is? That's the sound of your heart trying to communicate with you. That's the sound of your heart beating. That's the sound of your heart language. In order for you to interpret that, you have to have some way of a procedure to interpret that, what your heart is saying. Have you ever felt palpitations in your chest, and you didn't wonder why you was having palpitations? Have your heartbeat raced so fast and it's practically scared you? Well, there's ways of knowing what's going on. With today's advanced technologies, there's so many procedures, so many machines out there that can interpret what your heart is trying to tell you. And that procedure, which I'm going to be speaking about, is having an electrocardiogram test, also known as the EKG machine. Now, when you go to your physician's office, you wonder, your doctor always gives you an EKG machine year after year, and that's only because you may not have any chest pains, but they just want to see what you're, just to make sure that you're not having any changes from year to year. I used to work in the emergency department as a CNA, and I performed plenty of EKG testings, in which I don't interpret it because that's the responsibility of the physician. I just perform the testing. As I speak about electrocardiograms and how it communicates to you, communicates on how it communicates your heartbeats to you, as to what's going on, I will speak briefly about the history of the electrocardiogram, how the machine is used, and the different types of electrocardiograms that are out there in the world today. First, I'll briefly speak with you about the history of the electrocardiogram. The EKG was first discovered in 1794 by a physiologist named William Einthoven. He created the first galvanometer, which is an electrocardiogram, and at that time it can only sense the electricity of the heart. He paved the way for all of us to be able to be diagnosed as to what our hearts are telling us. As years went by, another well-known physiologist created another machine, a electrocardiogram machine, in which measured the current of the heart. This machine was known as the Remtone, and it was created by Du Bois-Reymond in 1868. Secondly, I will briefly discuss how the EKG is used to communicate with humans. When a person is receiving an EKG, they have to be in a very relaxed state of mind. To get the best picture of how your heart is beating is when you're in a relaxed state of mind. According to Robert J. Berg, an MD of WebMD, he encourages everyone to be able to avoid wearing any grease, lotions, applying any lotions to their skin, avoid wearing any stockings and wear shirts that's easily removable. Why? Because electrodes that are used in the EKG testing are used to be applied to the person's skin, and your skin has to be good and dry to get good conduction from what your heart is telling you. When the technician starts to perform the EKG test, he will tell the person to turn off all pagers, cell phones, iPods, anything, because the sound waves of those can interfere with the EKG testing, in which it will give a false reading. The patient is told to stay still, and as the patient stays still, it's like a 2 or 3, probably about 5 seconds max. The machine will read it, record it, and print out the results of your EKG, and it will look just like this. This is the copy of what your heart is saying to you, and this is a normal EKG reading. The EKG machine can translate anything about your heart. According to James Greer of North Dakota State University, it can tell you if you are having any signs of a heart attack. It can tell you if you're having early signs of heart disease. The EKG machine can also tell you your electrical pattern of your heart, and it can tell you about the amount of oxygen that your heart is receiving. When you are having an EKG, these EKGs give so much information. I mean, it's far from telling you if you're in a sinus rhythm, which is a regular heartbeat, or it'll say sinus brady, which is a slow heart rate. It also tells you if you're having a sinus tachycardia, which is having a fast heart rate, or sinus arrhythmia, which is basically an irregular heartbeat. Lastly, I want to talk about the different types of electrocardiogram machines that are out here. Now, there's so many machines out here today that, which is named, has different names, but it's all classified as electrocardiogram, but they all work according to Elizabeth Otto of How to Use EKG Machines on eHow. She says that regardless of all these machines out here, these electrocardiogram machines, how many is out here, they all do the same thing. They are set up the same way. They are operating the same way. And I mean, even though the styles vary, they all works the same way. Now, I work with a big, huge stationary EKG machine at work that's about the size of a copy machine, but there are several EKG machines that are small enough to fit in your pocket. The two I'll be speaking about is the Holter monitor, and the event monitor. The Holter monitor is a small portable EKG machine that can be used home. A doctor would give that person a Holter monitor to record the everyday, day-to-day activity of the person during their regular activities for 24 to 48 hours. Now, the event monitor is similar to the Holter monitor, and the only difference is the event monitor only records the actual palpitations that person is having. So that person would have to press a button on the event monitor in order for that machine to record that activity and regular activity of the patient's heart. Lastly, today, during my presentation today, I explained to you all on how your heart can communicate to you by an electrocardiogram machine. I gave you a brief history of the EKG machine creators, and then explained to you what the EKG can interpret. And finally, I told you about some of the types of EKG machines that are out here in the world. The next time you feel that squeeze in your chest, that palpitation that just don't feel right, or you feel some pain in the center of your chest, don't ignore it. Seek immediate medical attention, because the first thing you're going to need is to get that EKG done so we can find out what's going on. What is your heart telling you? Because obviously those are the signs and symptoms of something going wrong. If you do not heed the advice of seeking help, the last EKG that you will ever have is one that's going to be a flat line, which basically interprets to anybody, to doctors,